You are watching a master at work.
They are what they believe they are. The brain has learned to defend itself.
You think of them like they're supernaturally gifted, like they have powers or something. Karen, these are patients. They have been through trauma.
And perhaps now they are capable of something we are not. We have brain scans now. DID patients have changed their body chemistry with their thoughts.
Split is an interesting movie talking about one of the most mysterious and questionable psychiatric disease. It's multiple personality disorder or dissociative identity disorder. There is a big stigma here because a lot of people misname schizophrenia and DID. Schizophrenia is one of psychotic disease, unlike DID is one of dissociative disorders. Schizophrenia is a splitting of your mind, not splitting of your identity or character. Like your brain melts. And DID, when you have two characters or more than two characters at the same time. Some people have more than 20 characters. DID predominantly develops in people with childhood trauma and abuse or avoidance.
I believe that this brought up issues from when you were a child and abused. Sometimes another incident of abuse can cause suppressed personalities to take the light.
Kevin Wendell Crumb, you made a mess. Come out here. Kevin Wendell Crumb, you made a mess! Get out here!
Most of patients with DID not only have DID but also have or comorbid with depression, suicide, and anxiety disorders. So now we have the criteria to diagnose DID. You have a splitting of your characters or identity into two or more than two characters. This dissociation not caused by medical substance or other medical disease, and the criteria not described by other medical disease. And DID causes significant impairment of life. It's possible to control your characters or change between them in front of people.
I'm getting frightened. I thought that you had this under control. Please tell me it's not too late. Is she in that room?
We're here! Help us! We're in here!
What is this? How many are there? No. Don't go in there. Don't go in there. Don't worry. I'll talk to him.
May I talk to one of them, please?
That can't happen.
Okay, you can do it, but with some provoking. By making the patient in a specific situation or provoke specific emotion in his mind. The exciting part of DID not only have more than two characters or even 20 characters, but to have different gender and age. Like when you have a character with 10 years old boy and a character with 35 years old man. Even you have a character of female and you are a male.
My name's Hedwig. I have red socks.
How old are you?
9.
Like I said before, DID patients have a lot of comorbidity like suicide, anxiety, and depression. They also may have amnesia.
Who are you? What's happening?
Something horrible.
What'd I do?
Search on internet, you will find a lot of interviews with people have DID like this woman with Oprah.
Time the personalities come out, I'm afraid that I may never come back again.
With help from Kim Noble's therapist, Kim's alternate personalities come out one by one. First dominant personality, Patricia, disappears, and Bonnie takes over. Bonnie used to be the main personality who took care of daughter Amy.
Nice to see you.
DID is an interesting topic you can search about.